Hello and welcome to my channel. Today's case shows how quickly PVR can develop after a successful retinal detachment surgery. This patient was operated on for retinal detachment, uncomplicated, several months prior to this surgery, and then she had a successive visual deterioration, and it turned out she had an epiretinal membrane development. And because her visual acuity was 1.0 after the retinal detachment surgery, and she had gone down to 0.6 Snellen with epiretinal membrane, we decided to go on and do peeling surgery quite soon after the detection of the membranes. And you see here, the membranes are not just your typical epiretinal membranes over the macula. The proliferation was all over the retina and primarily in the posterior pole. And these cases cause very quick development of metamorphopsia. It's imperative to get them to the surgical table as soon as possible. And the adherence of the PVR is quite strong. And cases like this, and you will see this in the OCT images, nerve fiber layer schisis is commonly present, so one has to be quite careful as one peels off these membranes. So they're very strong, they're basically causing a tractional retinal detachment. A careful search for missed holes was done, but nothing was found. So one can wonder why there was such an aggressive secondary PVR development after successful retinal detachment surgery. And there are many postulated hypotheses. One is that there is a genetic tendency for some people to develop PVR. Another cause could be remnants of the posterior vitreous have remained attached and proliferated immensely. It could also be vitreous schisis, as in separation of the posterior hyaloid, which had any remnants which proliferated. And see, those are nerve fiber layer strands. Some petechiae over the macula, indicating how strong the adherence with attachments are. And as I mentioned earlier, at the end of this surgery, or at the end of this video, I'll show you preoperative as well as postoperative OCT images. A second coloring with membrane dual dye to remove any ILM in order to minimize the risk of reproliferation over the posterior pole. Does look much clearer now. I did opt to do some more laser in the previous areas, just in case there is a micro hole which is missed. Fluid air exchange is done. And you see here, this is an OCT image when the patient was detected. So an epiretinal membrane with some initial retinoschisis. The visual acuity was 0.6, and 2 weeks later, no more than that, did this aggressive membrane develop, and the visual acuity deteriorated furthermore to 0.1. And this is the OCT at the time of surgery. And here's the final OCT. Post-operative, visual acuity had returned to 0.6 about 4 months after surgery. The patient is not entirely satisfied, but it is much better than what she had initially. Thank you so much for watching.